Hey, this is Dr. Amanda from StraightSmile Solutions, and we're here still in our first module. We're going to be talking about open coil spring, how that works, and how to put one in, and when to put one in. So again, my parameters might be different from fast braces or 6-month smiles, but these are just, I think, more conservative parameters that most orthodontists will use. So I think if you're going to do ortho, you should treat it at the level of an orthodontist. So in any case, this is my philosophy for NiTi open coil springs. First of all, keep in mind that the diameters can be a little bit different. This is kind of like what I like. Never use a stainless steel open coil spring. It really doesn't do anything. So make sure it says nickel titanium. Medium force diameter 0.12 inch. Okay. It might come in long tubes. It might come in spools. It doesn't matter how it comes as long as it works like what it works. Okay. So what you're gonna want to do is only use open coil spring when you are on a rectangular wire, like we talked about before, okay? So you have to work your way up to that. And before you even get into the rectangular wire, let's take a step back, okay? Let's make sure, we have to make sure all our teeth are totally straight. That's my philosophy. You put the brackets on with your indirect bonding, you work your way up the wire. By the time you get to 16 NiTi, everything should be just about totally straight. If it's not, you need to re-evaluate your bracket positioning, or you need to use a ligature tie, okay, and get it all straight, or a little IPR is needed. Everything should be 100% straight before you go into the rectangular wire. If you're not sure, then you need to check in, okay? So this is the open coil spring. If you have a tooth that's blocked out, you might want to use that, or if you're trying to move around some midlines, you might want to use that. You want to cut a piece that's bigger than the space you have and then compact it, okay? On the heavier rectangular arch wire. I'm not sending you guys the rectangular arch wires because your typodont has crooked teeth and it wouldn't fit. So you're just going to have to simulate it on a lighter wire. But again, you're not going to be on this until you're like 6 months, 4 to 6 months into treatment probably. So it's not happening today. This is the ligature director. I did send you one of these. This is one of my favorites to compact open coil spring. It also helps you put on ligatures when needed. Okay. So go ahead and cut an active piece of NiTi open coil spring and put it in on one of those spaces on your typodont. I think there's some spaces in the lower anterior, like there's a blocked out tooth, and go ahead and simulate an active open coil spring tied in. Don't forget to send me pictures, front, side, up, bottom, top, bottom. And today we're going to be talking a little bit more about open coil spring. Now we have a few other videos about it, but I just wanted to clarify a few things. Anyways, let's briefly talk about what we do here at StraightSmile Solutions. We are a consulting agency. We help doctors and labs with their orthodontics. We don't collaborate with any specific system. We help you with any system. Doesn't matter if it's braces, aligners, Invisalign, clear correct, straight wire, self-lighting, grading braces, phase one appliances, habits, whatever you name it, we help you with that. The only thing we don't do right now is direct to consumer. So we're here to help you, help your patients. We'll help you find the best lab, the lowest lab fees, whatever you're looking for, we're there for you. Anyways, we can also have hands-on classes. So we train you how to do different things. Right now we offer all kinds of different classes on straight wire, hands-on braces, indirect bonding. We have destination classes, digital classes, you name it, we have it. So don't forget to go to our website at straightsmilesolutions.com. Real quick, you can go here. If you want to sign up real quick, you just push a button there. We have fees as low as one case, or you can get monthly subscription fees, which are crazy low. They're the lowest that are out there. You can't find anything else like that because our goal is to be available to the average dentist anywhere. So anyways, these are our price points just for a case or unlimited cases through electronic communication only through a HIPAA compliant portal, or unlimited cases per doctor, per office, with everything you need. So anyways, let's talk a little bit more about open coil spring. Remember, we talked about how you want to make sure, first of all, I would never do an open coil spring on a light NiTi like this, but this was a great typodont here. And I just wanted to kind of show you what type of case I might use it for. So this is just a great example. So in a case like this, let's say for example, with a displaced lateral incisor, you know, I might just engage this tooth. If it was more displaced, more palatable, or if I couldn't fully put the bracket on properly, this is a 50-50 whether or not I'd engage it or not at the first bonding session. But I just want to show you an example. There's not always a right or wrong way to do everything. So let's say, for example, I decided to bond this case, but I wasn't going to engage this tooth yet. I wanted to kind of retract this first or make some more space with an open coil spring so that this tooth would actually come forward, more predictably. So what I would do is I would not put an open coil spring on the first wire. No way, because it'll bow out, okay? So I would just go ahead and put my regular wires in, tie in my 12 or my 14 or my 16-9 tie, get things a little bit straighter, and when I can get to a heavier, more rectangular wire, then I'd place an open coil spring. But I just want to show you the example. So when you measure open coil spring, first of all, I always use 9 tie open coil spring. They do make stainless steel. I don't think that does that much. So be careful when you buy it. Make sure you're shopping for the right thing. There's a couple different gauges. I usually use 012. It's not too flexible, but it's still stiff enough to move teeth. I always cut it a little bit, about 1 bracket length bigger than the space I need. So this is not necessarily the ideal size right here. So you can see it's a little too long, right? That's why I just wanted to show you what not to do. And then we can kind of start to show you what to do. So this is more what I'm looking for. Maybe even a little bit less. It depends on what kind of wire I'm in. And then I'm going to go ahead. This is how I do it. Honestly, if you have good nails, which I do today, good acrylic nails or good gel nails, with gloves on, of course, you can go ahead and just do that with your fingernail under the glove. But you can also use my favorite instrument is the ligature director. If you do order our digital kit, this will come with it. But you can go ahead and just slide that open coil spring along. You need to make sure that you ligate the back teeth in first, though, otherwise the wire will just pop right out. Okay, but you can go ahead and just compress it. And once you compress it, you have to be pretty tricky here, because once you compress it, sometimes you can just compress it and it'll just hold, right there, like this bracket will just keep it compressed, but sometimes it pops out. So sometimes you have to do a two-handed movement. But basically, that's pretty much it. And then you can see I went in and tied it here. Again, disclaimer, I would not be doing this on this wire, but I just want to show you an example of a good case to do one on. Anyways, nor would I tie it like this. This is how the Typodont came. I just saw this right now. I would do this on the distal. Great example of power chain. I might repurpose this video for power chain. So anyways, this is not how you do your power chain, okay, if you want to retract a canine. But anyways, I hope this helps you know how to do an open coil spring. Don't forget to practice before you do it on a right patient, and always take progress pictures. It's great to have documentation. And oh, by the way, this is not how I would do an O-tie either. If this is not ligated fully, you really should do a figure 8, or you should do a stainless steel or quick tie. All right, thanks so much, everyone. There either. Have a great day. Don't forget to go to StraightSmileSolutions.com. Please like us on YouTube, subscribe. We're always adding new videos, and you can find us on all our social channels. We're pretty active on Insta. I'm super active on LinkedIn. You can find the link directly from our website, as well as Facebook, and we have some Facebook forums as well. All right, have a great day. Thanks.